a new station. What is HIV virus? HIV, male patient, known case of HIV, hepatitis B and C, presented with red groin mass after injection to the groin. What is HIV virus? HIV is a single-stranded RNA virus. HIV is a single-stranded RNA virus. What are the subtype of HIV? HIV-1, 95%, HIV-2, HIV-1 and HIV-2. HIV-1, 95%. What are the characteristics of HIV? It is a single-strand RNA virus from the family retrovirus. It is a single-strand RNA virus. It is a single-strand RNA virus from family retrovirus and transmitted through body fluid including blood, semen, vaginal fluid, anal mucus fluid, and breast milk. Transmitted through body fluid. Transmitted through body fluid including blood, semen. Transmitted through body fluid. Transmitted through body fluid including blood, semen, vaginal fluid, and mucus fluid, and breast.
সম্পদকে রক্ষা করছে।
Okay. What type is HIV virus? It is a single-strand RNA virus. RNA virus is type 1 and type 2. What is the characteristics of HIV? It is a single-stranded RNA virus from the family retrovirus, transmitted through transmitted through body fluid like semen, vaginal fluid, anal mucus secretion, breast milk, blood. Transmitted through semen, vaginal fluid, anal mucus fluid, and breast milk. What are the causes of true and false aneurysm? True aneurysm is formed by the weakening localized. True aneurysm is formed by the localized dilatation of the vessel wall. True aneurysm is formed by the weakening of the dilatation of true aneurysm. True aneurysm is formed by the localized dilatation. True aneurysm is formed by the weakening and dilatation of the vessel wall. True aneurysm is formed by the weakening and localized dilatation of the vessel wall and caused by the true aneurysm is formed by the weakening and dilatation, localized dilatation of the vessel wall. It is caused by congenital like Marfan syndrome, Ehlers-Danlos syndrome, acquired atherosclerosis, and infection syphilis. True aneurysm true aneurysm by Marfan congenital Marfan syndrome, congenital Marfan syndrome, by congenital Marfan syndrome, Marfan syndrome, Ehlers-Danlos syndrome, atherosclerosis, and syphilis. Ehlers-Danlos syndrome and syphilis. What are the causes of false aneurysm? False aneurysm is formed by the damage to the vessel wall. False aneurysm is formed by the damage to the vessel wall. False aneurysm is caused by damage to the vessel wall, leading to locally contained hematoma. It is caused by a trauma or surgery. False aneurysm is caused by the damage to the vessel wall, leading to locally contained hematoma caused by the trauma or surgery. Difference between true and false aneurysm. In true aneurysm, it is formed by the weakening and dilatation of the arterial wall involving all three layers. Mm, and false aneurysm is formed by the locally collection of the blood between the tunica media and adventitia. Adventitia. Which layer is affected in pseudoaneurysm? Tunica intima and media. Tunica intima and false aneurysm affect tunica intima and media. Tunica intima and media. And blood contained only by adventitia and surrounding the tissue. Mm, tunica intima and tunica adventitia. Tunica intima and tunica media. Tunica intima and tunica media is affected in severe aneurysm. Why does he have bleeding? Why does he have bleeding? He has bleeding due to trauma, coagulopathy due to he is bleeding due to trauma and coagulopathy due to depletion of the vitamin, bleeding due to trauma and due to coagulopathy because of trauma and coagulopathy due to depletion of vitamin K dependent and depletion of vitamin K dependent clotting factor 2792 due to liver affection with hepatitis B and C. Coagulopathy and due to depletion of the vitamin K dependent clotting factor due to affection of the clotting factor by hepatitis B and C. Precaution needed to stop bleeding. Washing hands, wearing double gloves, use surgical gown, mask over the head, and appropriate goggles. Stop bleeding by compression of the bleeding area. Stop bleeding by compression over the bleeding area. Use by washing hand, use sterile gloves. Sterile gloves. Wearing gown and surgical gown, mask and overhead protective glass. Stop bleeding by compression of the bleeding area. Stop bleeding by compression over the bleeding area. Stop bleeding by compression. Stop bleeding by compression. Stop bleeding by compression over the bleeding area. Mm, Stop bleeding by compression over the bleeding area. 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 You keep pressing on the wound, but bleeding. You keep pressing on the wound, but bleeding has not stopped. Why? Coagulopathy due to clotting factor 2719 deficiency, due to affection of the liver by hepatitis B and C. Coagulopathy due to depression of the vitamin K, clotting factor due to liver affection of the hepatitis B and C, and platelet depletion. Sequence of clotting. Injury to the blood vessel, platelet aggregation, and formation of the platelet plaque, then activation of the intrinsic pathway, then common pathway. Injury to the blood vessel, injury to the blood vessel, injury to the blood vessel, then platelet aggregation, formation of the platelet, injury to the blood vessel, sequence of include injury to the blood vessel, platelet aggregation, injury to the blood vessel, platelet aggregation, and formation of the platelet flag, and activation of the intensive pathway, then activation of the common pathway. Why are clotting factors not working properly? Because of coagulopathy due to depletion of vitamin K dependent clotting factor, and due to liver affection with hepatitis B and C, and low CD4 count with HIV lead to bone marrow failure. Low CD4 count with HIV, low CD4 count with HIV lead to bone marrow depletion. Low CD4 count with HIV patient lead to bone marrow failure. Okay, what is jaundice? Mm, Male patient and non case of gastrointestinal. Okay. What is jaundice? Yellow discoloration of the skin tissue and body fluid due to increased bilirubin in the blood. Yellow discoloration of the skin sclera and mucous membrane. Yellow discoloration of the skin sclera and mucous membrane, and due to increased bilirubin concentration in the blood is called jaundice. Why patient with GIST might present with jaundice? Gastrointestinal stromal tumor may present with jaundice because of biliary obstruction, and then the ampulla of the bladder from tumor compression, or metastasis to liver, or hepatotoxicity of imatinib use in treatment. Yeast, gastrointestinal stromal tumor, biliary obstruction around the ampulla of bladder, biliary obstruction around the biliary obstruction around the ampulla of biliary obstruction around the ampulla of bladder, from the tumor compression, biliary obstruction around the biliary obstruction around the ampulla of bladder, from the tumor compression, biliary obstruction around the biliary obstruction around the biliary obstruction around the biliary obstruction around biliary obstruction around the ampulla of Vater. Biliary obstruction around the ampulla of Vater, and liver metastasis to biliary obstruction around the ampullary of Vater, from the tumor compression, metastasis to liver, or hepatotoxicity due to use of hepatotoxic drug like imatinib. Hepatotoxicity of immunotherapy treatment. What is GIST? Gastrointestinal stromal tumor, a type of cancer that begins in the GI tract, arising mainly in the stomach and small intestine. This is a gastrointestinal stromal tumor. This is a type of cancer that begins in the GI tract, mainly in the stomach and the small intestine, mainly in the stomach and small intestine. Arise from interstitial cell of Kagel, found in the intestinal muscularis proparia. They arise from cell of Kagel. They arise from interstitial cell of Kagel. From interstitial cell of Kagel. Arise from interstitial cell of Kagel, found in the gastrointestinal muscularis proparia. Hmm. Okay. So, this is a gastrointestinal stromal tumor. They typically arise from gastrointestinal tract, mainly in the stomach and small intestine. They arise from interstitial cell of Kagel. They arise from interstitial cell of Kagel, found in the muscularis proparia. How does it differ from gastric carcinoma? Gist arise from mesenchymal origin of interstitial gist arise from mesenchymal origin of interstitial cell of Kagel. From epithelial cell. Okay. Mesenchymal cell. Gist arise from 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 mesenchymal cell mesenchymal cell of interstitial. Gist arise from mesenchymal origin. Gist arise from mesenchymal origin of interstitial cell of Kagel. Gist arise from mesenchymal cell of gist arise from mesenchymal origin. Gist arise from mesenchymal origin from interstitial cell of Kagel, and gastric adenocarcinoma arise from epithelial cell. Gist commonly metastasize by blood and uncommonly metastasized by lymph node, and gastric carcinoma mainly commonly spread to the lymph node. Gist mainly spread by the blood. Gist mainly spread by the blood, but adenocarcinoma mainly spread by the lymph node. Clinical presentation. Gist symptoms according to the location. Gist clinical presentation according to the location. Nausea and vomiting according to the location. Asymptomatic abdominal discomfort. Early satiety, weight loss, and GI bleeding. Just maybe abdominal discomfort, nausea, vomiting, early satiety, GI bleeding, jaundice and dysphagia. Patient presented with jaundice a few months later. Why? Jaundice because of obstruction, biliary obstruction around the ampulla of water by the tumor or metastasis to the liver, or hepatotoxicity by imatinib used in the treatment. Function of bile, emulsification of fat, into emulsification of fat into micelles, and thus provides greatly increased surface area for the emulsification of fat, emulsification of fat into micelle, emulsification of fat into micelle, emulsification of fat, emulsification of function of bile. Function of bile is emulsification of fat into micelle. Thus provide emulsification of fat into micelle. Thus provide the increase in surface area for action of the enzyme pancreatic lipase. Lipase thus provide emulsification of fat. It causes emulsification of fat. Emulsification of fat into micelle. Thus emulsification of fat into micelle thus increase the surface area for the action of the enzyme pancreatic lipase. How does bile salt help in emulsification of salt? Bile salt anion or bile salt anion has a hydrophilic and hydrophobic side. Um, they aggregate around the droplet of the lipid. They aggregate around the lipid to form micelle. Micelle. The hydrophobic side towards the fat and the hydrophilic side outside. The hydrophilic sides are negatively charged, and this prevent the fat droplet coated with bile to re-aggregate to form the larger particle. What is bilirubin conjugated to? Bilirubin glucuronic acid. Bilirubin conjugated to glucuronic acid by enzyme glucuronide transferase. Bilirubin is conjugated to glucuronic acid. Bilirubin is conjugated to glucuronic acid by enzyme glucuronide transferase. Glucuronic acid by enzyme glucuronide transferase. Bilirubin metabolism. uh, conjugated bilirubin in the bile comes in the small intestine, and bile acid mostly reabsorbed into enterohepatic circulation. But conjugated bilirubin is not absorbed. Bile in the small intestine, and the bile acid mostly reabsorbed into enterohepatic circulation, but conjugated bilirubin is not absorbed, and they enter into the large intestine, and the colonic bacteria de oxidized deconjugate the bilirubin, and they form again urobilirubinesin. This conjugated bilirubin not absorbed in the small intestine, and then they enter into the large gut. In the gut, it is a conjugate. It becomes deconjugate bilirubin to Europe starco to urobilinogen. 50% of the oxidized 50% oxidized by bacteria to starcobilin. This urobilinogen 50% is this urobilinogen 50% converted into starcobilin, and it forms the blue brown color of the stool, and 50% reabsorbed and 50% 50% reabsorbed. 50% reabsorbed. The part of reabsorbed go to enterohepatic circulation, and part of it go to the kidney and converted into urobilin, which forms the yellow color of the urine. What is urobilinogen and how it is formed? It is a colorless byproduct of the bilirubin. It is a colorless byproduct of the bilirubin metabolism formed by deconjugation of the what is starcobilin. It is a colorless byproduct of the bilirubin metabolism, which is produced by the gut flora by deconjugation. Define enterohepatic circulation. Reabsorption of bile salts from the terminal ileum and re-enter them back to the liver. Reabsorption of bile salts from the terminal ileum and re-enter into the liver. 95%. Reabsorption of the bile salts from the terminal ileum and return back to the liver. 95%. A mass had been found. How to diagnose it? A mass had been how to control it by CT, CT with contrast endoscopy, CT with contrast endoscopy, endoscopy and biopsy for pathology and immunohistochemistry endoscopy, CT with contrast, CT with contrast endoscopy with biopsy for histopathology and immunohistochemistry, CT with contrast endoscopy and biopsy for histopathology and immunohistochemistry. What is CD117? How to detect? CD117 is a transmembrane tyrosine kinase inhibitor, transmembrane tyrosine kinase receptor protein. Tyrosine kinase, it is tyrosine kinase tyrosine transmembrane. CD transmembrane tyrosine kinase receptor protein. Tyrosine kinase receptor protein encoded by c-KIT proto-oncogene. c-KIT proto-oncogene. It is a transmembrane. What is CD117? It is a proto transmembrane tyrosine kinase in receptor protein. It is a transmembrane tyrosine kinase receptor protein. Transmembrane tyrosine kinase and transmembrane tyrosine kinase receptor protein. 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 It is encoded by c-KIT proto-oncogene, encoded by c-KIT proto-oncogene, encoded by c-KIT proto-oncogene. How to detect it? By immunohistochemistry. Transmembrane tyrosine kinase inhibitor protein. It is encoded by c-KIT proto-oncogene. And how to detect it? By immunohistochemistry. What other cells that show CD 117 positive? Other cell, mast cell, hematopoietic stem cell and melanocyte. Mast cell, MMH, mast cell melanocyte, MMH, mast cell melanocyte, and hematopoietic stem cell. Management according to the symptom and size. If it is asymptomatic, if it is gist, if it is asymptomatic and tumor size less than, if it is asymptomatic and tumor size less than 2 centimeter, then endoscopic surveillance for 6 to 12 months. If it is asymptomatic, and if it is asymptomatic and if it is asymptomatic and tumor size less than 2 centimeter, then endoscopic surveillance with a 6 to endoscopic surveillance 2 to 6 to endoscopic surveillance 6 to 12 months. And if it is asymptomatic more than 2 centimeter, for surgical resection and imatinib therapy as a tyrosine kinase inhibitor. If it is symptomatic and size more than 2 centimeter, then surgical excision followed by imatinib therapy. What is the value of CD1 treatment? What is the value of CD117 in treatment? Monitoring treatment and response with tyrosine kinase. It can monitor the treatment. It can monitor the treatment and response with tyrosine kinase inhibitor. It can monitor the treatment. It can monitor the treatment response. It can monitor the treatment response with tyrosine kinase inhibitor. It can monitor the treatment with a tyrosine kinase inhibitor. After excision, the mass recurred. How do you know the gist is back? Biopsy with the histopathology and immunohistochemistry. We will do biopsy and send for histopathology and immunohistochemistry. Then histopathology and immunohistochemistry, and check for positive CD117. What is H. pylori? What part of the stomach is really affected? H. pylori is a gram-negative microaerophilic spiral bacteria found in the stomach. It is a gram-negative microaerophilic spiral bacteria found in the stomach. Affects mainly the antrum. What cancer other than what cancer other than adenoma does H. pylori causes? Adenoma, they cause maltoma, M-A-L-T-O-M-A, maltoma. They can cause adenoma, they can cause adenoma and maltoma. Krishna, 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 and maltoma. They can cause adenoma and maltoma. They can cause adenoma and maltoma. They can cause adenoma. They can cause adenoma and they can cause adenoma and maltoma. They can cause they can cause adenoma and maltoma. They can cause adenoma, adenoma and maltoma. They can cause adenoma and maltoma. They can cause adenoma and maltoma. Causes of vitamin B12 deficiency, lack of intrinsic factor that help in absorption of vitamin B12, lack of intrinsic factor that help in vitamin B12 absorption. Other causes of macrocytosis, folate deficiency, malabsorption, alcoholism, folate deficiency, folate deficiency, alcoholism, folate deficiency, alcoholism, extremism. What are the type of aneurysm? Macrocytic anemia is pylori causes macrocytic anemia causes of vitamin B12, lack of intensive factor, alcoholism, lack of absorption, lack of intensive factor, alcoholism, lack of absorption. Please note see obstructive jaundice in Haribol. Jai Sri Krishna Chaitanya Prabhu Nityananda Sri Advaita Gadadhar Srivasadi Sri Gaura Bhakta Vrinda. Hare Krishna, Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama, Hare Rama, Rama Rama, Hare Hare. Jai Srila Prabhupada ki, Jai Guru Maharaj ki, Jai Guru Shri Premanande, Hare Hare Bol.